All right, welcome to The Explainer. Today, we're diving into a medical emergency that's kind of like a secret agent of death. We're talking about shock, a condition where a totally normal blood pressure can be hiding a catastrophic problem. So let's really get into this, right? Because that single question, it gets to the absolute core of why understanding shock isn't just important, it's critical for anyone in medicine, and honestly, it's pretty fascinating for the rest of us too.
Okay, so first things first, let's get on the same page about what we're actually talking about. Because shock, yeah, it's not what you see in the movies. It's a huge, often invisible killer.
And here's the absolute key takeaway, the big idea. Shock isn't really about that number on the blood pressure cuff. It's a crisis of oxygen delivery. A full-blown starvation happening at the tiniest level inside your very cells.
And this is exactly what we mean by the invisible threat. There's a term for it, occult hypoperfusion. It's a fantastic, slightly spooky term, right? It literally means a war is being fought and lost inside the body, cell by cell, even when the monitors look totally fine. It's terrifying. All right, let's put on our microscopic goggles and zoom way, way in. We're going to see what actually goes down when perfusion fails and this whole horrible cascade kicks off.
You have to understand, this isn't a slow process. It's a lightning-fast, catastrophic chain reaction. See, without oxygen, the cells flip a switch to a backup generator. The problem? This backup power is super inefficient and creates a ton of toxic waste. That toxic environment causes their internal machinery, these tiny vital pumps, to just break. And the end results? The cells swell up like water balloons, they burst, and they die. It's a cellular apocalypse.
Now, the body's no quitter, right? It's going to fight back. It launches this massive, all-hands-on-deck emergency response. The heart starts beating like a drum, blood vessels clamp down hard, all to reroute blood to the VIPs, the brain and the heart. But here's the catch. This is a temporary fix. It's a desperate move that comes at a huge cost, basically sacrificing places like your gut and your muscles to save the command center. So even though the core problem is always the same, those starving cells, there are actually 4 main ways the system can fail. 4 different root causes. Think of them as the 4 different faces of this failure.
Okay, first up, we've got hypovolemic shock. The easiest way to think about this one is the empty tank problem. Your circulatory system is supposed to be a closed loop, full of fluid. Well, in hypovolemic shock, you're losing that fluid. The tank is running dry. This could be from a big, obvious bleed, a hemorrhage, or something sneakier like really severe dehydration.
All right, next on the list, cardiogenic shock. Now, in this case, the tank is totally full. The problem? The pump is broken. This is the classic scenario after a massive heart attack. The heart muscle itself is just too weak or damaged to pump the blood effectively.
Then you've got obstructive shock. So picture this. Your tank is full, your pump is working just fine, but there's a roadblock. The pipes are blocked. Something is literally, physically, in the way, preventing blood from getting where it needs to go. A huge blood clot in the lungs is a classic example, or even fluid building up around the heart, squeezing it so it can't fill. And last but not least, we have distributive shock. Now this one's a little different, a bit of a curveball. What happens here is that massive inflammation makes all the blood vessels, the pipes, get super wide and leaky. So you haven't lost any blood, but the container holding it just got way, way bigger. The pressure just plummets. The absolute classic example of this is septic shock from a runaway infection. Okay, take a look at this table. This is where it gets really cool for the medical detectives out there. It breaks down things like cardiac output, that's how much blood the heart's pumping, and vascular resistance, basically how tight or loose the blood vessels are. Each type of shock leaves a unique fingerprint, a different pattern. And it's by looking at these patterns the doctors can figure out exactly which of the 4 problems they're up against.
So what happens if you don't catch this and turn it around and fast? Well, the body's emergency measures, they can't last forever. They start to fail. And that kicks off this terrifying downward spiral, a self-feeding cycle that just gets worse and worse.
And understanding this progression is absolutely key. You can see it right here in the table. The blood pressure, it doesn't really drop until you're already in the moderate stage. Think about that. By the time the blood pressure is low, the organs are already starting to fail. This is why waiting for that number to drop is like waiting for the smoke alarm to go off when the house is already engulfed in flames. It's too late.
And this slide perfectly shows that vicious cycle. In trauma, they call it the lethal triad for a reason. Okay, follow this. The lack of oxygen creates acid in the blood. That acid stops your blood from clotting properly, which of course means you bleed more. More bleeding means worse shock, which means more acid, and around you go. Each problem feeds the others.
So how in the world do you stop this death spiral? Let's talk about resuscitation. Let's talk about how you slam on the brakes and reverse this thing.
The first goal is simple. Get circulation back, and do it yesterday. And the playbook is pretty straightforward. ABC, right? Airway and breathing first. You have to be able to get oxygen in. Then, unless you have a really obvious clue that it's the heart, you always assume the tank is low. You start pouring in fluids while you frantically search for the real cause. And of course, if there's a hole in the bucket, you gotta plug the hole. You can't fill a system that's actively leaking.
But here's a super important point. You don't just stop when the pulse and blood pressure look good again. You have to look deeper. You have to look at these global markers. That number there, serum lactate, if it's high, it's screaming at you that somewhere cells are still starving for oxygen. This is how you hunt down and kill that occult hypoperfusion. You prove the problem is solved at the cellular level, not just on the monitor.
Now, sometimes fluids alone aren't gonna cut it. That's when you bring in the heavy hitters, vasoactive drugs. If you've got that distributive shock, the leaky, baggy pipes, use vasopressors to squeeze them tight and bring the pressure back up. But if it's cardiogenic shock, a failing pump, use a different tool, inotropes, which basically give the heart muscle a kick to make it squeeze harder. Okay, let's bring it all home. What are the absolute must-know high-yield takeaways here? Number 1, shock is a cellular disease. It's about tissue perfusion, not blood pressure. Number 2, low blood pressure is a late sign, a very, very late sign. The real killer is that occult hypoperfusion happening long before. And that means you have to treat the patient, not the monitor. You have to think about perfusion, not just pressure. And when in doubt, fill the tank and stop the leak. And you know, that brings up a really powerful final thought, doesn't it? This whole idea that the most dangerous sign can be a late one. It goes way beyond the emergency room. It really makes you wonder, right? What other late signs are we missing in our own lives? What other ticking time bombs are we ignoring just because the surface looks calm for now?